Hello, 1808. My name is Gregory Barone. I'm here to talk to you about the rising issue of PTSD in women. As the population of women in the military is rising, the already high rate of women with PTSD will only grow higher. PTSD reduces the quality of life of patients affected by it. Quality of life should be the focus of the treatments, and thus we should look into the differences in the risk and protective factors of the men and women. The difference between the general population and the patients of the VA hospital is the VA hospital patients are typically in poorer health. As the rate of men and women with PTSD increases, there needs to be a focus placed on the populations of these individuals in order to treat and prevent as much as possible. However, due to the extraneous circumstances that women in the military experience, they have a higher rate of PTSD to their male counterparts. As of 2005, the percentage of active duty forces increased to be about 14% women. Not only is the number of women in the armed forces increasing, but the women are also being placed onto the front lines. After a trauma, women are more than twice as likely to develop PTSD than men, and the rate for women is 10% and 4% for men. This high rate is due to women are more likely to experience sexual assault, and sexual assault is more likely to cause PTSD than many other events, and women are more likely to blame themselves for trauma experiences than men. Female military personnel have to deal with experiences that few men have to deal with, on top of the experiences every military person has to deal with. Women entering the military already have a high rate of trauma before coming into the military, and the trauma only escalates from there. 30 to 45% of female veterans faced military sexual assault on top of the trauma from combat. Due to these increased factors, the female veterans represent a highly traumatized population in need of significant mental and physical care. Women who enter military services are more likely to have had trauma in their adolescent life. According to the graph, women are more likely to experience an adverse childhood experience, and this is seen in the population of women veterans. There is not a single category from substance abuse at home to an incarcerated family member that men have a higher percentage of the population. Of the population of female veterans, a high amount of them enter the military with extensive trauma histories, only to receive more once they enlist. PTSD in men and women is beginning to be looked at under the MRI. As seen in the picture, the brain of a PTSD patient and the healthy individual is visibly different. It has become associated with other psychiatric morbidities, particularly major depression. There are other psychiatric morbidities that PTSD is comparable with, including anxiety and panic disorder. According to a study conducted by Ann Sadler, the violence against women are an important public health concern. The quality of life for women who are raped or physically assaulted during their military service report that the physical and emotional effects are there 10 years later. There is a serious effect on their work and social activities, leading to difficulties living a life after the military. Women with both traumas, listed a few seconds earlier, reported the most severe impairment comparable to women with chronic illnesses. As technology is advancing, so is our ability to help patients through the use of their cell phones. This application, the PTSD Coach, is designed to help patients with PTSD to better understand and manage their symptoms. As family members and loved ones of the patient want to help, the use of the application can be for them as well, in order to better understand the disease and how to enable the patient to live their life to the fullest. The application has showed promising results but will need further testing in order for the findings to be published as accurate. Finally, I will leave you with some discussion questions to think about. Question 1. As a medical professional, or even better, a public health official, how would you propose a change for the military to better protect their female members in their ranks? And question 2. Does the higher rate of PTSD in female patients seem surprising to you? And why do you believe this issue is not reported more in the media? Thank you for watching and listening, and I hope I opened up your eyes to a population in need.